First question I have for you today is, can
Okay.
you explain the difference between optimal and conventional lab work standards?
One of the best ways, I think, to an example of this particular question is looking at thyroid levels. The traditional testing for thyroid in general is something called TSH, or thyroid stimulating hormone. And that is actually a measure that's coming from your brain and not always directly connected to your actual thyroid hormones, which are most commonly T3 and T4. What happens is that if your thyroid is making hormones, T3 and T4, they run around in your bloodstream, and there's receptors all over your body that fuel them and measure them. And there's a sensor in your brain that says, is there enough thyroid hormone? Yes or no. If the brain senses there's not enough thyroid hormone, then it sends a signal called TSH, thyroid stimulating hormone, from the brain to the thyroid to kind of yell at the thyroid. So if T3 and T4 or your thyroid hormones are low, then the brain is going to increase the TSH signal. So high TSH implies that something's not quite right. What happens is that when laboratories receive a blood sample from a doctor's office or from a lab or wherever, people that are responsible for running that test have no information about that patient except for their date of birth and their name. And so there is zero connection between, is this a male or female? Is this person on hormone replacement or thyroid medication? Is this person symptomatic or not? And so basically the lab just receives all this blood. And every couple of years, the lab is required through regulation standards to give a reference range, which is basically 95% of the people who came and had TSH done fall within this range. And there is zero conversation about whether those people are healthy or not healthy, or symptomatic or not symptomatic, male or female, that sort of thing. And so reference range, depending on the lab, either you're getting it through Quest or LabCorp or other specialty labs, that reference range is generally about 0.4 to 4.5. And what we have found is that if we do some further evaluation and investigation into what does that number look like for somebody who has no thyroid symptoms and in fact feels really good, right? So that would be considered optimal. When you feel good, your weight's good, you don't have fatigue, you don't have all those symptoms that we talked about earlier, that TSH reference range is much tighter. It's between 1 and 2. So basically, that's the goal that we're looking for when somebody is either presenting with any symptoms, to say thyroid seems to be working appropriately or not, and or if we have somebody on thyroid hormone replacement, then we want to aim for that reference range between 1 and 2. That is what optimal is. So if you're presenting with those symptoms and you go to traditional doctors and traditional labs, and maybe your test is 3.5, which falls within range, but actually that's too high. And that could be a sign that your brain is yelling at the thyroid basically to do a better job because something isn't quite right.